How to quit drugs without going to rehab or having any sort of treatment. Now this is difficult to do. It depends on the drug of choice. So some drugs have a withdrawal syndrome, like crack cocaine and the opioids. Those are going to be much more difficult to quit on your own because there's a sickness with it. Whereas the other ones, marijuana, cocaine, methamphetamine, tend not to have much of a withdrawal syndrome, and it'll be a little bit easier to quit on your own. So regardless, the way to do it is to wean. It's not a good idea to suddenly stop any sort of drug cold turkey, because it's going to produce a withdrawal syndrome or some sort of discomfort regardless of the drug. So it's better to wean down to lower doses. If somebody, and the wean, the length of time that this person is tapered off their meds or their drugs depends on how long they've been using them for. So the longer time they've been using them, then the longer time the taper should happen. So with the opioids, I'm just going to start with that because that's my specialty, and I would not recommend doing it at home. It's better to do it in a detox or at a rehab facility where you have more help, because stopping the drugs is only 15% of quitting. Quitting requires the other 85%, which is lifestyle changes, learning how to cope with life stresses, problems in life without medicating, without using our crutch. And to learn these new ways of coping is basically learned in rehabs, because it encourages people to have balance in their life and equips them with tools on how to deal with life's adversity and how to manage. The drug of choice generally is a crutch to handle stress. So when they don't have the drug of choice and there's a stress, there needs to be some form of coping and healthy coping. So another way to treat this as well, though, if a person is totally against going to rehab, is to slowly wean off or taper their dose, generally by 10% a day, over as many days as needed. More rapid detoxes can occur, but the person's going to go through more rapid withdrawal and a deeper withdrawal, so it's a balance. I don't believe any of these detox drinks. I don't think they work whatsoever. I think a good nutrition, balanced diet, and lots of fluid intake is important to prevent any issues. The other way with the opioids, anyway, to get off them and to wean, is to substitute it, to stop the opioid, but to substitute with an opioid replacement therapy or opioid agonist therapy. So this is Suboxone or methadone. This enables a person to not feel a euphoria, especially with Suboxone, which is the newer drug. They don't feel the euphoria, and they also don't end up chasing the high either. It enables to feel them normal. So they are no longer going through the discomfort of withdrawal, and they can get back to normal life routines. So in summary, how to quit drugs without going to rehab is not a good idea, but for some drugs like marijuana, cocaine, methamphetamine, is maybe a better likelihood because they don't have a strong withdrawal syndrome. However, with the other ones that do, like opioids and crack cocaine, there is a withdrawal syndrome and less likelihood of being able to be successful quitting on your own. That being said, slowly tapering the dose by about 10% a day over several days is the best thing to do. A rapid detox is not a good idea because relapse is much more likely to happen, and when a person relapses on these drugs, they can go overboard and end up causing an overdose. They don't realize, they tend to resume the drug dose they were using beforehand and quickly get back to that area where they're using so much, and they can cause an unintentional overdose. And the final way is to get on opioid replacement therapy. So this is substituting their drug of choice, if this is an opioid, to go to Suboxone, which is the latest one, or methadone, which is the older one. The newest one, Suboxone, is a pill, whereas methadone is a liquid. But either one allows them to function, to not go through withdrawal, and to get on this replacement therapy in a way that achieves a steady state so they're comfortable. And eventually the idea is to wean that over several weeks to months, and so they can start feeling a little bit better. Thanks for listening.
If you or a loved one are looking for help with substance abuse, call our 24/7 helpline at 1-800-615-1067. A caring addiction advisor is awaiting your call.